patient budgeting to help improve your operations and your bottom line. What would be the value to your agency to have a tool that could help improve your bottom line as well as your case management and training activities while reducing errors? That is exactly what the Home Healthcare Resource Planner was designed to do. We developed the Resource Planner to help agencies improve how they manage the financial impact of caring for any and every patient, regardless of payer source. It works for any payer that reimburses via the PPS or the per-visit methodology, including Medicare Advantage plans that follow PPS but reimburse at discounted rates. Understanding the costs and profits of projected resources empowers your staff. Armed with that knowledge, they can manage the limited resources better while providing the necessary care for any given patient. This enables your agency to increase your bottom line without the need for increased revenues while maintaining and/or achieving high-quality outcomes. For example, if your agency has annual revenues of $1.5 million, 0.5% increase in your bottom line would equate to a pickup of $7,500. If it created a 3% increase in your bottom line, that would equate to a pickup of $45,000. Depending on your current operations, you could see an increase in your bottom line of somewhere between 0.5 and 10+%. Additionally, you can run the Resource Planner at any time. There is no requirement to do it immediately after you have completed an OASIS. You can do it then, but you can also do it an hour later, a day later, a week later, etc., 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 even after the end of the episode. Furthermore, the Resource Planner is a useful tool in your case management and staff training activities. It can help improve case management by comparing your budgeted resources to the resources used for that episode, which also helps with best practices. And training it has a twofold benefit. One, as a follow-up to case management to help identify staff training issues, and two, to teach those who create care plans what financial impact their care decisions have. This will enable them to make better choices for the company's financial bottom line and still give the best possible care. The Resource Planner also reduces errors by using drop-down menus for much of the data entry, such as 1. Selecting a branch. This associates the cost to be used for this patient encounter. As your discipline costs per visit are already built into the program, your staff do not need to carry these around to complete a patient budget, thereby eliminating the chance of using out-of-date rates or keying errors. 2. Selecting a payer. This ensures that the budget will be completed based on the most current reimbursement rates for that payer. 3. Select county of service. Ensures that the correct CBSA is used for any budget that follows the PPS methodology. And 4. Select the HIPS or HERG code information. This ensures that the correct revenue is to be used for this patient budget, and this also identifies the allowable therapy visit range for the HIPS-HERG information selected. In addition, the Resource Planner benefits the budgeting process by 1. Making the patient budgeting process simple and unintimidating. 2. Instantly showing the results of any and all changes that impact revenues and/or expenses. 3. Identifying whether or not the projected therapy visits are within the allowable range via green and red visual indicators. 4. Showing a large gold indicator when a LUPA situation exists and identifying the applicable LUPA revenue. 5. Projecting the costs of the proposed chargeable medical supplies for the episode to accurately calculate total costs. If you provide medical supplies and you do not account for those costs, you are overstating your projected profit. This is a very common error in the industry, and this overstatement can be very significant. Six, giving you the ability to account for the additional costs for those episodes that need much more than the norm in chargeable medical supplies, for example, ostomy and or wound care patients and the like. And seven, giving you the ability to set a desired profit margin for any and every payer. And these desired profit margins can be unique for each payer. As you can see, there are many ways that the Home Health Care Resource Planner can provide benefit to your agency's operations and bottom line. We developed this program to help evolve patient budgeting to become a quick yet very sophisticated process for every agency that wants to take their company to the cutting edge of operational excellence, while also preparing them for the next big expected change in home health reimbursement: pay for performance. Please contact us at your earliest convenience to receive a demonstration to help you see how this program can help your agency's operations and improve your bottom line.